Well, good afternoon, everybody. It's been a few days. I hope you had a relaxing Memorial Day weekend. A lot to catch up on. Here with Paul and Josh, and here with two of my favorite mayors. I've got Sherry Cantor, the mayor of West Hartford, and I've got Freddie Camillo, who's first selectman of my hometown of Greenwich. They both made the mistake of having a nice coffee with me this weekend, and here they are. Let me first give you a brief update on where we are over the last few days. I'll just go with this slide because I think it's indicative of what we tried to do. I think it's interesting. Hospitalizations were up a little bit yesterday. That was just a tremor. I think we're in a strong, steady state. You'll see in a minute. Fatalities, tragic, but heading down. And the number of people who have been infected, I guess that's what, about 7%? No, a little more than that for this session, isn't it? I thought it was interesting. You see 225,000 tests performed to date. We just got off the phone with Vice President Pence and his task force. That includes Deborah Birx, Mr. Fauci, that includes Secretary Azar, and they pointed out that now 50 states have tested at least 2% of their population. Connecticut has tested about 6.5% of our population. And we're ramping up pretty quickly. We're not the champ by any means. Rhode Island is a champ with about 12% tested, but we're gaining on you, Gina. I think you'll see that in terms of our positivity rate, they pointed out to me that the average in the country is about 7.5% of those who test positive. And we're about that over the last week, although we've been trending down recently. The next slide just gives you an idea that our overall hospitalization is down about 65% from where we are, say, in mid-April, down 65%. And I think you see a fairly consistent line there, which is shared, I might add, with most of our regional governors. Next slide, the testing overview, I think is, again, indicative of the fact that little red blurb down there at the bottom, those are the folks who are tested positive. But most importantly, you see that we're generally trending less than 10%. That puts us in the best half of the states out there, and the trend is going in a very positive direction. The next slide is just a reminder that, I've gotten all the analysis from all of our different commissioners, the analysis from our Reopen Advisory Board, and I put that together with a lot of help, by the way, in terms of our Reopen report. And we're going to be releasing that, I think, within a couple of hours. And it just gives you our overview on, A, what our public health strategy is. We've gone over this with key players, our current activity and procedures, especially as regards our plans for testing, where we've been, where we're going, track and trace, the economic impact and analysis, which is so key, and finally, the reopening criteria themselves. Let me just stay on that slide for a minute, if I could. The economic impact analysis and the reopening criteria. I was sort of interested, Vice President Pence was just giving us an update on where where all the states stand against different metrics. He pointed out that 44 states now allow elective surgeries. Many of these surgeries have been put off, but now it's 44 states, almost all the states. It's worth remembering that Connecticut never stopped doing elective surgeries. At least, certainly, the governor never issued an EO to that effect. It was up to the hospitals. They made the determination when they started going back doing these elective surgeries, and I'm glad they did. And again, I remind people there's capacity. Don't put off these surgeries any longer. A lot of them sound elective, but they're really important to do. And I'd also remind you, go see your primary care doc. Vaccinations are down in this state and across the country, in part because folks sometimes don't feel comfortable seeing the doc. Now is the time to do that. Now is the time to get your vaccination. And Dr. Fauci was pretty firm in terms of we may not know exactly when we're going to get a COVID vaccine, but we do know we've got a flu vaccine, and really strongly urge everybody do that this fall. I was sort of interested. Now we have 50 states that allow curbside pickup for all of the essential businesses. We never stopped doing that here in Connecticut. 38 states are now do all the personal care. We started that last week, And now we're going to have the hair salons later on this week, I think it is. And then we're going to finally do nails and tattoo and the rest of that probably on June 20th. So we're sort of in the middle when it comes to where our regional and nationally in terms of the personal care things. Restaurants. 37 states have opened up restaurants to one degree or another, most of them just for outside. So we're right with our neighbors there. Now, just 34 states have opened up non-essential services. All of our non-essential services never closed. They mainly opened just for takeout until recently. And now all of our non-essential, those are stores on Main Street perhaps, are open and will continue to be open. Houses of worship, the Vice President pointed out, now 30 states allow houses of worship to be open, usually with real limitations in terms of capacity. Connecticut, of course, never closed any of our houses of worship, although we're pretty strict in terms of a number of people who could be there, say 50. And we're going to take a look at that over the course of the next week or so and get back to you in terms of what we might be able to do there, both indoors and outdoors. The next slide is just some of the social guidelines, just a real reminder. And I had occasion to talk to, both Sherry and Freddie about this. I wanted to get an insight in terms of how we're doing around the state, how people are in terms of paying attention to the social guidelines that we put in place. And I heard from my fellow governors, it's sort of all over the map. Some people are really paying close attention. Some are getting a little more casual. The stay home, stay safe for at-risk individuals, more important than ever. Face masks and covering. I think we've been pretty good, maybe slipping a little bit, but pretty good. And Dr. Birx today just reminded us over and over again, there's nothing more important. And that's what's key to the social distancing. And I'll tell you, as we look around the world, obviously South Korea, we know about their nightclubs opening and what that did in terms of the super spreader, why we've got to be cautious there. Brazil, they pointed out that President Trump is going to start limiting visitors from Brazil. Brazil now has a higher infection rate than the United States of America. And in part, they have some very dense neighborhoods there. They call them favela, and there it's a contagion, and it's serious. And we are in this together, including Brazil. We don't want that to come back and get us. What else? I think the next slide sort of says it all. We are not the Ozarks, but this is the Ozarks. I think it was in Arkansas. It was they had strict social distancing protocols in place for this outdoor water park. But as you can see, some folks are getting a little less responsible in terms of what's going on. I heard that from some of our other governors as well. I was talking to James Ravella, who's our public safety, and I pointed out that in Houston there were 500 citations for bars. These are all reasons that we got to continue to be cautious if we can continue to reopen our great economy. With that, let me just get some insights from two mayors right on the front lines, one from the southern part of the state, one from right here in West Hartford. I'll start with Sherry Cantor. And Sherry, I'd just love to hear your instincts as we opened up our stores, opened up our businesses, opened up our restaurants. What'd you see?
Well, I saw a lot of business owners that were very anxious started and bring back their customers and serve the people that they love, as are the customers that so missed these places being actively open. Many were working on takeout and things, but for the most part, people are very, very respectful and understanding of the situation that we need to socially distance and wearing face coverings. Governor, we were out to dinner at the Delamar Hotel on Friday night. We sat outside in a beautiful garden, socially distanced. The waiters and waitresses all had face coverings, as did everybody coming in and going out of the restaurant. It was a really nice respite from a very long pause, and it felt so good to be out and really having us being able to talk to people about how much it meant for them to get out and go to one of their favorite places. husband and I actually took a tour around the center and spoke to many restaurant owners who said this is, it's kind of a gradual opening, but as we extend our outdoor eating capacity, with making sure that we're safe. With some of them are going to be sharing road with cars, and we need to make sure those tables are safe. That they're very excited to kind of re-envision and reimagine a new West Hartford with even more outdoor activity. We have a lot in town, and we're excited for that phase. But always with the caveat that we have to socially distance and wear face masks or face coverings, or we're not going to be able to get to that next phase. And that's such an important point that you raised. So thank you. I think we'll continue to take our baby steps and look at the data.
Well, thank you, Sherry. And it was nice to see you on Friday night, not in the Zoom video conference. And Freddie, I'd love your point of view, and you may have a slightly different point of view because you're right on the border with New York, which has not opened up their restaurants even for outdoor dining.
Yes, Governor, and first of all, I want to thank you for your leadership, your communication, and as always, your willingness to listen to different ideas about how we go about reopening our state and doing so in a measured way. As you saw the other day, yesterday, people are walking. Lots have masks on and keeping distance, but some aren't. It's hard to tell sometimes who's in a family unit and who's not. We are on the front line. We are right near the original hot zone on the East Coast, New Rochelle, about less than 15 minutes away, surrounded by, next to some towns that have been hit pretty hard. But I think people are ready to open up, even if they're being very, cautious as we partially reopen. But we're also looking at it here in Greenwich as not only a partial reopening in the short term. We're looking how we could take this and extend it on a more permanent basis. So whatever we do now is to get the economy up and running again. And thank you for your ideas and for listening to ideas yesterday about what would help going forward. But we want to see how our town would look on the other side of this. What could we do right now that would lay the groundwork for a new Greenwich, or where we were yesterday, a new Greenwich Avenue, and take that and to go to the various parts of our town, whether it's Coscow, Byram, Old Greenwich, and see what we can do there that would enhance our town on the other side of this. And it's this tragic time has forced us to look at things to be a little bit more efficient and more effective. And as the mayor was saying, to reimagine our town and our state after this. And I think we all have our eye on that. And again, I agree with the mayor that we don't want to take any steps backwards. It's taken a lot to get us where we are right now, and we're very proud of that and happy. But we're still in the middle of it, and we still want to keep our eye on the ball and our foot on the pedal and make sure that we get through this without taking any steps backwards.
Well, thank you, Fred, and thank you, Sherry. You've both done a really thoughtful job of reopening your town cities in a thoughtful way. And they're going to both stay here, so ask them some tough questions. Max, back to you.
NBC, Connecticut.
Governor, wanted to get your thoughts on the first phase of the reopening, how you feel it's going, if the state's received any complaints regarding compliance issues.
Some, but not a lot. I mean, again, you see that picture of the Ozarks, and Connecticut was smart, I think, this last weekend. Maybe the weather helped a little bit on Saturday, to be blunt. I know that our parks, I know that our hiking trails were busy. I think probably twice the load they're used to this time of the year. But people were responsible. We had to close down some of the parking once they got close to capacity. I think this first 5 days of the reopening and this last busy weekend, we managed pretty well. I think I heard that from the mayors as well.
And I also wanted to get your thoughts on outdoor in-person graduations. Massachusetts is allowing them for late July. New Jersey has announced that they're allowing them for early July. Any thoughts on that for Connecticut?
Yeah, we said not during the month of June. We said it's too early, and we're sticking to that. We also said we're going to take a look at July and August and give you some guidance on that pretty soon based upon all the metrics we described at length.
Thank you.
News 12 Connecticut. Channel 3 Eyewitness News.
Governor, talking about some of the things that you're still concerned about, where do casinos rank on that list right now?
They're a concern. As we heard on the Vice President Pence's team this morning, what they really see for this summer is the idea of flare-ups. We know about flare-ups in nursing homes, in correctional facilities, and meatpacking facilities. And we want to make sure that, when our casinos open, they do it in a very thoughtful and prudent way. Does not put any of the people who are going there as customers at risk, does not put employees at risk, and does not put those, when they get back out to the general community, does not put the general community at risk. So we are talking to them, making sure that, when they open, they do it in a very thoughtful way.
I'm not sure I got all of your answer on that. I apologize. So the discussions that you've had with the tribes, where do they stand, and is the target date for them still the 1st of June?
I think, I'm afraid it is for them. It's still June 1st, but we had Deirdre and David and Michelle. We were out there today. They were out there walking through, looking at the protocols. They were responsive. We had some specific issues that we said would definitely enhance the public health there in a dramatic way. So rather than me get back and forth in those discussions right now, let's see how it sorts out over the next couple of days.
And really briefly for Josh, do we have a nursing home update? What's the status in some of our homes right now?
Sure. Well, the teams continue to conduct on-site inspections. We're now over 850 on-site inspections completed, both by our DPH staff and our National Guard additional supports. Those inspections continue to go well overall. Issues have been identified. We've released the first round of findings and reports last week. The numbers are trending in a more positive direction. We continue to ramp up the testing in the nursing homes as well. So still a lot of work to be done, but good progress overall.
Fox 61.
Governor, you mentioned that we should be getting this reopened report later today, but is there anything in their new guidelines that we haven't heard of yet?
No. I think it's a pretty good summary of a lot of what we've been discussing out loud with you and with the legislative leaders over the course of the last few weeks. And I think you've heard Deirdre as well as Josh and Paul, flesh out a lot of what this is. It puts it in one place, and you see our reasoning from start to finish.
And then I see that you posted the picture of the Ozark. Is there any concerns? This was the first weekend for beaches, really good weather. Is there concerns for beaches and too many people as the summer gets underway?
It's questions about beaches, and I'm going to pass this over to Freddie in a second. But we were very careful on our beaches. As you know, I was very happy that Rhode Island opened up their beaches for Memorial Day. For out-of-towners or out-of-staters, so to speak, we were able to limit them and charge a little bit extra. I think we were able to manage that. And what I've heard anecdotally is that people were pretty appropriate on the beaches. Is that true, Dad, at Todd's point, friend?
Yes, it is, Governor. Right now we just have opened it up to walking and trying to putting arrows to make sure that they're going in the same direction and not crisscrossing each other. But it's, as you know, Todd's presents some challenges on the ingress and egress, and we have lots of different activities, whether they're walkers, hikers, bikers, strollers. But as far as the sand part of the park goes, the actual laying out on the sand, we are developing a plan for that. We would be very, I guess, in line with what you've suggested, which is no more than groups of no more than 5 and spread out by about 15 feet. So what we have to do then is make sure that we have the proper monitoring in place. And so whether it's Parks and Recreation monitors or lifeguards or some members of the GPD, or some combination thereof, we will make sure that people can get out there and enjoy our beaches. And as you know, we have several of them and really beautiful places to go and spend a summer day. But we want to make sure people do so in a safe manner.
News 8.
For Mayor Cantor, have you had to issue any warnings or summonses for people who are not following the rules?
We have had to talk to people. The police are getting calls. Our health department are getting calls. Our health department is actually doing also sort of drop-in and keeping an eye on things. So it's more of a recommendation and strong requests rather than infractions or any kind of enforcement. We don't feel that that's the best way to go. We are going to be requiring, we're actually, strongly recommending that everybody wear a face mask, face covering in West Hartford Center. It is going to be hard, I think, at certain times to remain 6 feet apart. And for everyone's safety, that will help us to maintain the quality and the outdoor vibrancy that we think we can do in a very safe way.
Is it pushback or more lack of education?
Mostly it's lack of education or reminders. And sometimes, I like the First Selectman said, this is a lot of times it's a family unit and people don't think. There was actually a family of 6 sitting at a table outside eating on Friday night when I walked around, and you wouldn't necessarily know that they were a one family unit. Same thing with several people walking, 4 or 5 people walking together, even siblings. So it is more of a reminder and a strong education and there hasn't been pushback. We haven't seen it.
Thank you. And Governor, last question. President Trump has recommended churches be back open again. Where do churches stand in Connecticut? What will it look like, and what are you recommending?
Well, of course, our churches and houses of worship never closed. We did have a cap of 50 people there. We're now in good conversations with all the religious leaders, and we'll come out with some new protocols, very soon. Obviously favoring outdoor worship services over indoor worship services, and thinking about the capacity of the house of worship as we think about the number of people. Outdoors is so much safer, and seniors staying home is so much safer.
Boceto Media.
Hello, Governor. Can you give details on how is the state of Connecticut implementing that $1.4 billion on the current crisis?
Yeah, the question is about the $1.4 billion in aid that Connecticut received from the federal government, the CARES money. And the first thing we did was we went to all of our towns and municipalities, and we said, give us an itemization of all of your COVID-related expenses. And I think at the end of last week, Melissa McCaw got the final inventory of that. Josh is busy compiling all of our COVID-related expenses here at the federal level, everything from social services to testing, as we put together what that $1.4 billion budget looks like. And I think Melissa ought to have that done the next week or so. Does that sound about right?
That sounds exactly right. What we're going to see this week, now that we received all the information from the municipalities, is you're going to see basically a breakdown of funding that will be provided to municipalities sometime later this week. In addition, for other additional funds, particularly the education funds, the State Department of Education is putting together the framework and working with the local school districts and provided guidelines and information on that. That will also be provided in the next coming weeks as well. So we are thoroughly working through and make sure that we are able to utilize that funding, but the key is we have to make sure we're utilizing the funding in the most appropriate manner as provided by federal guidelines.
And Governor, is there any details that you can provide to further the public health strategy to educate the community about protecting themselves when they go out? Because still a lot of people are very stubborn to protect themselves and are risking the community. So what is the plans or the strategy with the money that the federal government sent to distribute it with the municipalities, and that way educate the people about protecting themselves?
Yeah, the question, of course, is about some people a little casual about wearing the facial mask and the such, and we're doing PSAs, public service announcements on that. We are reminding people every day the mask is not there just to protect you. It's there to protect everybody around you, there to protect the people you love. It's a selfless act, and it's a really important act. And I think you heard from Freddie and Sherry and our own observations. So far, I think people are taking it seriously. There's some who aren't, and we're paying attention to that.
My last question, Governor, would be yesterday, Black and Puerto Rican caucus legislators were protesting in different nursing homes. They are asking you to press more, to put pressure on nursing homes that are not providing PPE equipment to their workers. What actions are you going to take?
The question is about masks and gowns for the workers at the nursing homes. And they have the PPE. They have the masks and gowns. We've been providing that to them all along. Maybe they provided some on their own, which would have been good. And then we also had to provide training to make sure they used it in an appropriate way. You have anything to add on that, Josh?
No, I think that's right. And also, there's been extensive continuing deliveries to the nursing homes of PPE, and there's also been federal deliveries to the nursing homes that have been occurring. So we do think they're should be well stocked. That said, we've observed through this crisis that when you have 215 nursing homes in this state, on any given day, there may be a small number who are not doing what they need to do, and that's why we're doing these on-site inspections. That's why we're taking disciplinary action where necessary. But overall, we think they're doing the right things.
Thank you.
WTIC 1080 News.
Hi, Mr. Governor. I know you've been invited to tour Foxwoods before their intended opening next Monday. What's the update on that situation?
Well, I mentioned before that we had a team go out there today, walk through, I think it was Mohegan Sun to be exact. We haven't done Foxwoods yet. I'm probably going to hold back. 65 and older, I don't think it's appropriate to be going to these big, large gatherings right now. But I'm going to get a report back, and we're going to give Mohegan Sun some, constructive observations of what we saw as we try to get closer to a safe resolution to this.
The governor asked his team, led by the regulator Michelle Siegel of Department of Consumer Protection, DJ Gifford, who's the acting commissioner of Department of Public Health, and David Lehman, who's the commissioner of Department of Economic Community Development, who created the guidelines that we are working under in the state in our retail, restaurants, and you go down the line. He asked them to go there and basically do a thorough review, go through the plans with each of the tribal nations and their casinos, and to really provide back to the governor feedback on it. That team has visited Mohegan Sun today, and they'll be visiting Foxwoods at a later date. And so the governor will have more details on where he stands based upon the review of those plans by the commissioners presented to him.
Does the governor have any, if they decide to go ahead and you don't approve, how does that look Sunday into Monday?
If they decide to go ahead on June 1 and not take any of our suggestions in terms of how to do it on a more safe basis, I would warn people about that situation, because a big, large congregate setting that attracts older people from all over the region is not good unless it's done right. And right now we're going to do everything we can to make sure it's done right.
Thank you.
The Associated Press.
Good afternoon, everyone. Governor, to follow up on that, do you foresee any situation where you think it would be okay for the casinos to open on June 1st?
I think June 1st is too early. I think I've said that pretty clearly. I can tell you that our neighboring governors all agree. But we're talking to a sovereign nation, and they have their own set of priorities there. But so we're trying to work this together. If I can get them to delay it, even a couple weeks makes a world of difference. You know how long 2 weeks is in COVID years. And short of that, do everything we can to make sure they open it in the healthiest way possible.
And sort of along those lines, do you think that Connecticut will have a tourism campaign this year? Will we eventually be inviting people to come back to enjoy Connecticut this summer?
Yeah, I think we will, Sue. I mean, you saw that in our reopening plan, June 20 is the date we have in mind to reopen our hotels, not earlier than that. and that's going to be part of what we've done in terms of Mystic and some of the seaport and the aquariums and opening up this state a little bit. Tourism is a key part of the state. 2 months ago, we wanted to discourage travel in and out of the state. I think it's still too early right now. I think June 20 is a good date.
But are you planning a statewide tourism campaign this year?
Let me get back to you on the specifics of that with David Lamont, but we've got to remind people what a beautiful state this is.
Okay, thank you.
The Day of New London.
Hello, Governor. One more question on the casino matter. Based on the letter your Commissioner Siegel sent to tribes last week and pointed out there were clauses in the compact, you think the compact does give you some leverage to prevent the tribes from opening in defiance of your wishes? Yeah, let me stop there. Is that so? I mean, if it comes to that, could you invoke something in the compact to prevent them from moving forward?
That's not quite the way I see it. They've been good partners for many years. They closed down voluntarily. We thought it was the right decision. They did it. They did it at considerable financial cost to themselves. They're eager to get open. They've got economic reasons for doing that, obviously. And we're trying to work carefully with them. Michelle, in that letter, involved alcohol. I noticed that the casinos in California, as they're opening, most of them are voluntarily not going to be serving alcohol, at least to start off. Makes pretty good sense to me. I find 3 drinks is not great for social distancing.
So you think that through your powers of persuasion, you can get them to delay this by a couple of weeks? That's still your hope?
Either that or open it on a safer basis.
I see. Thank you.
Thank you.
The Hartford Current.
Thanks, Max. Governor, continuing with the casinos, you had briefly mentioned, I guess, last week something about revoking their liquor permits. Under what circumstances would you revoke their liquor permits?
Look, we're looking at that. As I said to the previous question, you're serving drinks. You're inside. People have to take off their masks. They're doing a lot of lingering. It doesn't necessarily conducive to social distancing. If you want to open up your casino safely, I would put that off a little bit and let's see how we can manage this for the near term. So I would strongly recommend let's not do alcohol up front, just like they voluntarily did in California.
Can you also tell us about if the casinos do open June 1st, and you were said a second ago you'd like to push it off to the 20th. If they do open on June 1st, will you have consumer protection officials there at the casinos watching the alcohol serving, and will you have public health officials watching social distancing and things of that nature?
I don't think it's going to come to that. We've got a good, strong relationship, and either we'll agree that serving alcohol on day one at the casino is not the right thing, and then the tribes will voluntarily police that themselves. They've got a lot of franchises in there, national companies. I think we all want to work together on this.
And one last thing, in the coming days and weeks, tell us what you're going to be doing about contact tracing. There have been some concerns there about staffing and training and things of that nature. What will you be doing to speed that up?
Contact, you got that.
Yeah, so, the project's very much on schedule. This is, implementing a new software platform, which for those who've been part of that before, know this is following a typical pattern. You stand it up, you get people on board. We've now got almost 600 local health officials and volunteers registered on the system. We've got 9 local health departments using the system live to trace actual contacts. So they're making great progress, but people have ideas about enhancements you can make. We're working through those, but the team's doing a good job and very much making the kind of progress that we need to have the robust contact tracing infrastructure in place to support our municipalities to make sure that as we get into the summer and the case rates get low, that we have all of the infrastructure in place to track those contacts and make sure we stamp out any outbreaks before they spread so that we try to avoid a rebound.
CT News Junkie.
Thanks, Max. Governor, what liability do child care providers or any business like a restaurant or even a hotel that's opening in the second phase have if a person contracts COVID-19 in their establishment?
Yeah, Christine, I think we came out with a strict and clear set of protocols. And my instinct on this is that if the daycare provider, if that restaurant, if that casino follow the strict set of protocols that we've established, that is a legal defense. If you don't, if you're sloppy, then there is no defense for that.
Okay. And then what is the benchmark for holding off on phase 2? What does the statistics have to look like on a daily basis to say, hey, we got to delay phase 2?
All the lines that are going in the right direction start going in the wrong direction. Certainly hospitalizations, certainly COVID-related hospitalizations. If we see a number of flare-ups and we see infections picking up, not just in say a nursing home, but especially broadly in the population or in certain regions, we take a good hard look at redirecting. I don't want that to happen. That's why we're opening now cautiously.
Yeah,
is there a specific number on that?
Yeah, we included specific metrics last Wednesday in the press conference talking about phase 2, and that'll be in the report that we're releasing this evening as well.
Okay, and then are you going to recommend that nursing homes test all of their staff?
I think we're testing all of their staff right now. We're testing every patient right now. Maybe the question is how often we do that?
Yes, we are recommending that.
Okay, so you're recommending, I knew that all patients were being tested, perhaps on a weekly basis, but all staff are being added to that?
That is absolutely part of our strategy, focusing on the most at-risk populations, aligning where we're trying to focus from a state perspective on testing. These are private businesses, as you know, and so we're working with them to figure out the right way to get that to happen. Some nursing home operators have already taken the initiative and have started doing that already. We applaud that, but we're working to push the rest of them to ensure that that's starting to happen more frequently.
Is this happening in congregate care elsewhere in the state of Connecticut, like state-owned properties, Connecticut Valley Hospital? The prisons I know are beginning to get tested. How quickly is that rolling out?
Yeah, we've been ramping that up over the last week and a half now as well. So we've been testing extensively in our prisons, both correctional officers and inmates. We've been testing at some of our DEMIS facilities. You mentioned CVH. We've been testing at CVH. We've been expanding to other congregate facilities. Again, the strategy here, and it's laid out in the report very clearly, the governor's talked about this in multiple other press conferences, is based on the public health guidelines where you have groups of people essentially living together in close quarters. Those are the high-risk areas, and so that's consistently where the strategy is focused for repeated testing of people who may not have symptoms yet, but we know could be asymptomatic carriers. That's the major focus in the strategy.
Thanks.
Connecticut Mirror.
Good afternoon. Governor, has Gina Raimondo consulted with you since she spoke last week on the casino issue? She expressed serious reservations about the 2 tribal casinos opening and said that Rhode Island's casino would not be opening, she said perhaps mid-June, perhaps July. So any conversations there since last Thursday or so?
No, we have talked, and she would like to see the openings put off at least till mid-June. And she said if you can get your casinos in Connecticut to put off to mid-June, Rhode Island and Massachusetts could do the same. If your casinos, Governor Lamont, want to jump ahead of everybody, even earlier than the Las Vegas casinos are opening, then her strong feeling is that the other casinos would be sure to follow.
So is there any action item on that as to what the governors can do together to put further pressure on the tribes?
We've certainly talking in very clear way what those protocols are, how to do it safely, when we'd like you to open. That said, Paz, as you know, these are a sovereign nation. That's pointed out to me in the first sentence of every conversation. And so we got to work this out together. If people are really reluctant, and we have smoking and drinking and 65-year-olds, and maybe we have some friendly reminders to state police, saying, hey, this is not safe right now. I don't think that's going to happen. I think we're going to be able to work through this collaboratively.
And last thing, antibody testing now seems to be pretty easy to get. Is that a mandatory report to the DPH for any test that shows somebody was positive for COVID antibodies?
Yes, the antibody tests are reportable to DPH.
And have you guys figured out what you're going to do with that data as far as trying to judge how the reopening is going?
Yeah, so the challenge there is that it's not a scientific sample, right? It's people essentially either part of a research studies in some cases, or people can go and order them privately now, the antibody tests at labs. So we're trying to figure out what that data could be used for. We're also pursuing separately, and we'll talk more about this in the near future, it's mentioned in the report, but a more scientifically based survey, antibody survey that we're looking to conduct through the month of June to give us a more statistically accurate view of what the infection rate has been in the state of Connecticut to this point.
Thank you.
Hearst, Connecticut Media.
Thanks, Max. Could I ask, this is Ken Dixon, could I ask Fred and Sherry, what kind of, what are they telling their local restaurants that do not have outdoor dining?
So this is Mayor Cantor, Sherry Cantor. I will, Fred, if you don't mind.
Sure.
Many of them have been doing takeout and might continue to do takeout. Some have either public. They might have a little lot in the back with other parking potentially on the road. We've looked at that. We are looking at all different options for people, places that don't have outdoor dining. And we are talking to the restaurants and asking what their vision is, what they would like to see, and how they think they would perform best. So we're taking in all those ideas and trying to accommodate all the possible models that might work. Thank you.
Ken, sorry there, getting phone calls. Ken, so I spoke to a few, but not many in that regard, but we are exploring some possibilities where if there is any establishment, whether it be retail or a restaurant, if they don't have any outdoor dining capabilities, could we as a municipality offer them some of our own space, whether it be a field or a parking lot, and do so without exposure to the town when it comes to liability. And there seems to be some room to, some possibility to do that. We're still going over everything with all the stakeholders, including risk management here in Town Hall. So we want to offer the same opportunities to every small and local business that those that have the outdoor dining capabilities, and it just may take a little bit of creativity and I guess some waivers, but we certainly want everybody to have the same chance at succeeding.
Thanks, Governor. I'm under the impression that the Rhode Island's opening up indoor dining for 50% on June 1st. Is this still kind of a moving target, this June 20th date for indoor dining, or not?
We have said June 20th for indoor dining, but I'll tell you one of the reasons, and I'll ask Freddie Camillo this. I mean, one reason is that New Yorkers, it's closed in Westchester County. It's closed in the Bronx. That's a half-an-hour drive. And there's some thought that if we open everything up indoor as well as outdoor, a lot of traffic could be going back and forth. Or maybe, Freddie, we could ask the local restaurants there to prioritize reservations for Connecticut people. What's your thought on that?
Well, that is certainly a concern, Governor. as we go around town every day, walking and driving around, we're seeing lots of New York plates. Now, it doesn't necessarily mean that they're all coming here to dine. We are seeing lots of people from New York City who are now looking to rent here in Greenwich and possibly buy because of the space that it affords them, where maybe the city doesn't offer that. So it's hard to tell. And there also are Greenwich residents, as you know, that may have some cars that are registered in New York. So while we certainly don't know exactly each car, what they're doing here, why, it is a concern. And when we were the first day we opened up on the 20th, as we walked Greenwich Avenue, we met quite a few people that had come over the border to grab something to eat, which we love. But again, we are going to have to keep an eye on that, especially with the limited capacity going forward here, at least until we're on the other side of this.
Governor, could I ask you quickly whether you've thought more about definitive dates for camps and summer school?
Yeah, we have said, outdoor day camps, June 20th, June 21st, summer school probably soon thereafter, later July. You say, why summer camps and not school? As we described before, one's outside, one's inside, a smaller group for the summer camps. And summer camps will, if that goes well, that opens up for summer school. We want to get those kids back learning, not just waiting for September.
How about sleepaway camps, Governor?
I think it's probably going to be too late. We're practically in June now. In order for them to know that they can have a sleepaway camp in July or August, they need a clear determination from us now. And it's just too early for us to give them that clear determination.
Thank you.
Waterbury Republican American.
Thank you. Governor, I believe on Friday you and Commissioner Lehman in a talk with the Waterbury Regional Chamber talked about a gradual reopening of state offices after July 20th, I think was the date. Can you and Josh give us a little more details on when state offices might be reopening?
Yeah, I'll start it off and then pass the baton, which is my want. Right now, our offices, like a lot of the other offices around the state, will be able to reopen at 50% capacity. But our strong recommendation is if you can telecommute a little bit longer. I think that's in your best interest and our best interest.
Yeah, that's exactly right. So the team's done a great job of adapting to telecommuting. A lot of teams staying very productive. As you know, a huge percentage of the state never changed anything, right? A lot of frontline workers, a lot of first responders, so there's no changes there. In between, there are some services that, as you know, we had to discontinue to support our public health goals. And so for each agency, it's a very different calculation in terms of what those specific services are, how important it is that we get them turned back on quickly, and how they could possibly do that while minimizing the additional risk. So we're working through that with each of the agencies sequentially. And as we see the opportunity to start to reintroduce some services that have been discontinued, we'll look to do that as quickly as possible.
When do you expect the state workforce will be back to working in their offices rather than telecommuting?
Well, I think it's the same answer for other office-based employees. We're trying to follow consistent guidance, and the guidance from our public health team and from our governor is that if you have the ability at this point in time to continue telecommuting, then you should continue to do that, and we're following that guidance ourselves. Okay, and one of the services that goes with one of our reader questions. We've got several readers that are asking us when fingerprint service is going to resume so people can continue on with their application for a pistol permit or an ammunition permit or long arm permit. Yeah, as soon as services are able to be recontinued, we'll be making announcements, or the respective agency will be making announcements about that.
I think it's any day is what I was told.
Correct. I think it's coming soon.
Yes.
For that one.
Okay, and Governor, we've had two budget estimates come out in the last week, one from the Office of Policy and Management and another one today from the Legislature's Office of Fiscal Analysis. Each are showing about a $300 million to $360 million reduction in the fiscal 2020 deficit. Just your thoughts on those two developments and where the state stands financially.
I'm tired of Washington, D.C. when it comes to the next supplemental saying, let's wait and see. I've got two mayors right here who are sort of saying, hey, give us a little indication. What can we expect in terms of our budget? We have a July 1 start date, just like you do. And, right now, Melissa McCaw is putting together our budget with some assumptions about what you might see in the next federal supplemental. But it doesn't do us any good for them to just put this off and put this off. For our planning purposes, we need this. It's really important for all of our local budgets, all of our local school budgets. They want to have a better idea of exactly what they can expect from us as well as from the feds. Right now, our plan is to hold everybody harmless, but let's see what we get from the federal government. I hope that's going to be in the next couple of weeks.
And in terms of a special session of the legislature to deal with some of these tax issues that you've brought up and other related matters before July 1st?
Yeah, my understanding is the leadership is talking about when they can come back for a special session. The last I heard was perhaps sometime in mid-June. That's their call, but welcome back.
Okay, thank you very much.
Connecticut Public Media.
When it comes to enforcing social distancing and just safe practices at businesses, you said luckily over the weekend it seemed things went pretty well, but God forbid things do take a turn when the weather gets warmer. Is it the towns that have to enforce these rules, or is the state going to get involved if some businesses are violating them?
Well, I'll start it off and then pass it to our mayors. But as you know, we've come up with a very clear set of guidelines, including safe stores, safe workplaces. We have a 211 hotline where people can report if they find that people are not following these protocols very seriously. From there, we like working with the local municipalities. They know the community the best, be it public health or their local police. And if you need help, then we can step in. Anything to add on that?
Mayor Cantor, you go first.
Okay, thank you. We are in partnership with our police department, our public health officials, and we will educate people, tell people what they need to do, and if there's not compliance, then if there are ways that we can enforce, we will. And the health department has actually a lot of power right now to enforce noncompliance.
I would echo that and say that so far when we go around and look at all our establishments, for the most part, just about everybody's in compliance. But then you'll get home at night and you'll get a few emails or text messages saying so and so wasn't. I went to this place and there was somebody didn't have a mask on or gloves, and so we reported to our health department, but at some point the next day, a friendly member of our local police department will stop down there and politely remind them of the protocols and guidelines, and it usually goes right away.
And a question about testing. Do you think we're doing a better job in testing in underserved communities, and how is the state measuring that?
I think we're doing a much better job of testing the underserved communities. As we've said before, we've got the mobile vans are getting out there. We've got the CVS and the local abilities to get tested as well. We're making a big effort to give people incentives to get tested and making sure they want to get tested, making sure that if they test positive, there's a place they can go where they know they can be safe. Working with their employers, making sure they're protected if they have to take a time off. There's nothing more important than making sure those communities that are most at risk are tested. That's a priority for us. I'm getting the signal. I think that could be it for all of our questions. Look, it's the type of day I enjoy. We spend some time working with the federal government and trying to get that partnership constructive going forward. And here I am with, two of our favorite mayors here from different parts of the state, trying to give you an idea of how we think about the social protocols, how we get the state moving again. They're responsible. They're right on the front line. As you heard, they're also in the front line in terms of enforcing this. It's a soft enforcement, but I think you heard from both Sherry and Freddie, it seems to be working. There's no Ozarks here in Connecticut, not yet, and for that I'm very appreciative. Thank you, everybody.